Pharmaceutical drugs are crucial to modern medicine, from Tylenol to cancer treatments. But as you may know, the drug development process is a very long one. First, a team of experts must research and develop the drug in a laboratory setting. Then, preclinical testing is done, where the drug is tested on animals to make sure that it's safe and responds similarly to how we would expect in humans. Finally, a clinical trial is performed to make sure that the drug is safe and effective in humans. Now, this long process means that people who need life-saving treatment have to wait a long time to get it. So what if we could streamline this process and test these drugs on human cells from the very beginning? To illustrate how we might do this, I'd like you to imagine that you run an embroidery business, and your client has requested this complex design. You know that there are a couple different ways you could do this. First, you can hand embroider everything. This would mean you'd have to change the thread every time you need a new color. You might make a lot of mistakes, so it's very inefficient, and your hand's probably going to hurt by the end of it. Or you could get an embroidery machine. This would automate the process greatly, allowing you to change thread color very easily, make very few mistakes, and allow you to do any pattern that you want. In an analogous way, I'd like you to imagine that you're a researcher, and you want to understand how your new drug affects different organs in the body. Or maybe you're interested in early embryo development, or even stem cell development. So you've decided the best way to do this is through organoids. An organoid is just a structure of cells that mimic the behavior of a human organ, like a lung or a heart. So similar to your embroidery project, there are a couple ways that you can develop this. First, you can use microinjection, which means individually injecting each cell with the molecule of interest. Now, you can imagine, sort of like hand embroidering your project, this is very time consuming, requires specialized training. It can damage your cells as well. So what if you had a tool, kind of like your embroidery machine, but for your cells, that would let you deliver molecules in any pattern, and it would be very efficient, have little to no error, and would greatly optimize your process? Well, that's what we're aiming to do in the Fedorov lab here at Georgia Tech with the Precise Area Introduction and Transfection, or PAINT device. This device acts like a paintbrush. It allows you to draw out any pattern that you want and deliver molecules to cells in that pattern. It uses a plasma jet here on the right, which is just a highly energized gas, to destabilize the cell membrane, and simultaneously an electrospray jet, which is just a very fine mist of charged droplets from a liquid, to actually deliver your biomolecules from a solution. So what's unique about this device is its point and shoot approach allows you to edit cells in any pattern. So this versatile spatial control is very unique. Now, this device not only will make the development of organoids much more rapid, it can also be used for cell therapy, which is currently not an efficient process, and it will make pharmaceutical testing much more reliable and efficient. So this means that people who need this life-saving treatment we were talking about will get it much more quickly. Now, in our lab so far, we have demonstrated that paint can deliver molecules to cells while keeping them alive. So you can see here this image of the plasma jet and electrospray jet. And right here, we demonstrated the delivery of just a fluorescent molecule to cells in a straight line path. We have also been conducting viability testing, where we use a certain stain that only stains dead cells to see how our plasma treatment affects their viability. And we found that there's very little cell death, which is great for the future of this device. So this device will revolutionize the future of drug development and delivery. Thank you.